name is Kristen Okopian. I'm one of the occupational therapists here at Muskegon Surgical Associates at the MSA Hand Center. I work closely with Dr. Ostrick and Dr. Terlouw, our two main hand surgeons here. Today I'm going to talk to you a little bit about what to expect after surgery to release a Dupuytren's contracture. A little bit to know about Dupuytren's. Not too many people know exactly the cause of it. We do know there's a genetic component, and it is found a lot in Northern European descent patients, which of course here in West Michigan we do have an abundance of. So the Dupuytren's contracture is when there's a shortening of a cord in the palm of the hand and diseased tissue forms around it, causing a flexor contracture. The surgeons do an amazing job of releasing that contracture, and then it's up to us in therapy to keep that great result. So usually people do phenomenal with this procedure, and what we are to do is you come see us and we make you a night splint. Our docs prefer that you wear this splint for night only 4 to 6 months after surgery to make sure that you get the best result possible. The splints, very, very easy, look just something like this. And what that is to keep the fingers as straight as possible at nighttime, just so they don't remember to do that curved in motion. On that first visit, also, aside from making the splint, we'll just take some initial measurements, make sure that you're moving appropriately. We will give you some exercises to do. Those we recommend that you'll do a few times a day, and we'll send you home with a handout, so there's no issues with that. As long as you are still in your post-op splint, which we do recommend that you still have on until you see one of us therapists or the surgeon or the PA, we'll take that off, get you all washed up, and make sure that there's no signs of infection and that the wound is healing appropriately. The only other thing that you may see us for in therapy after this procedure is if you tend to scar a little bit more. These incisions, because of the way that they heal in the thicker tissue of the palm, can sometimes scar and cause a little bit more adhesions, which can limit your movement. So a lot of times we'll do modalities like ultrasound to soften and break up that scar tissue, just to make sure that you have the best outcome possible. Other than that, it's usually maybe one visit, maybe a couple more just as follow-up, just to make sure everything is going okay. If you have any further therapy questions regarding this procedure, please feel free to give us a call at the Hand Center at 231-246-2440.